Good morning. The patient in room 431 is 28-year-old Divine Pearl. The patient is a G5P2 and currently 28 weeks gestation. She's presenting today with signs of regular painful uterine contractions, which is likely due to preterm labor. The plan of care that I suggest for this patient is as follows. The patient's vital signs should be monitored regularly, and a fetal monitor should be used to monitor the fetal heart rate. The uterine contraction should be assessed, and the duration, intensity, and frequency should be measured. A vaginal fetal fibronectin sample should be obtained to determine if the amniotic sac is disturbed. A vaginal pH test can be performed to determine if preterm premature rupture of membranes is likely. Then I will assess her cervix to determine dilation and effacement. I plan to assess the patient for other signs of preterm labor, such as vaginal bleeding, pelvic pressure, and any lower back pain. Given her history of preterm labor and her current gestational age, it's likely that we will treat her here in the hospital. First, it is necessary that we insert an intravenous line for fluids and any other medications that she may require during her stay here. The patient should be given a tocolytic, such as a terbutaline injection, to relax the uterus and stop the contractions. She should be monitored for side effects from a terbutaline injection, such as tachycardia, cardiac arrhythmias, transient hyperglycemia, signs of myocardial ischemia, and tremors. If delivery is imminent, a steroid such as a betamethasone injection will be given to help support fetal lung maturation. The patient needs to be monitored very closely during this time. I believe that the patient should not be discharged home until after her delivery. Based on her presenting symptoms and her history of preterm labor with her 2 previous children, it's advisable for this patient to stay in the hospital on bed rest. That way we can monitor her closely and perform an emergency delivery if necessary.